After weeks of record-breaking COVID case numbers, we're now seeing the resulting hospitalization numbers, and they're just staggering. Joining us from just outside of New York City is Bloomberg's senior healthcare editor, Drew Armstrong. Drew, it's good to see you today. Thanks for being here. I want to get right into the numbers. How does the records that we're now seeing translate into hospital stays in the U.S.?
Yeah, so I think there's two ways to look at this. First of all, we've hit a record in terms of the number of positive tests that are happening around the U.S. About 130,000 cases identified yesterday. And, it's important to know that the rate of positive tests, it's not a perfect metric because it kind of depends who you're testing. And, you're testing symptomatic people. It's not a population-wide survey, but it is going up as well. So it means basically not only are we testing more people, more of the people we are testing, a greater share of those are positive, which is partly why we're seeing this record number of cases. Typically, once people do get sick, it often takes them a little while to end up in the hospital. We're now seeing the in-hospital results of all of those positive tests that we've seen in the record-breaking days over the last several weeks. There's 62,000 people hospitalized with COVID-19 in the U.S. As of yesterday. That is up 50% over just 3 weeks. And given the number of positive tests hitting records just yesterday, that number seems like it's only going to be going up. And unfortunately, and this is the really tragic part of this, that deaths tend to follow that by several weeks after. So really not a lot of good news out there in terms of the trends that we are seeing across the country right now.
What are the models that you're seeing in terms of expected deaths by the end of the year?
I actually am always a little bit reluctant to cite some of the models. There are a lot out there, but they tend to, if you talk to anybody the folks that work on these models, they give you an idea of what the country looks like, but they're very, they all caution, don't use these for predictions. I'm always hesitant to say the models say this, the models say that, because inevitably they're a little bit off. They also depend on what we do. They depend on, if a vaccine starts to get rolled out at the end of this year, maybe it has some impact. Therapies get better. So I actually urge people shy away from the models. I don't think that they're useful numbers. That said, if we keep up with this pace of 1,000 deaths a day, we're likely on track, just the way things are, for 300,000 plus deaths in the U.S. by the end of this year. It'll be one of the top causes of death in America for the year, which is pretty much unprecedented to see a new top cause of death enter into the picture. I mean, that's the kind of thing you see in major natural disasters and wars.
Yeah, it's absolutely staggering and heartbreaking, not just here in the United States, but of course around the world. These records are not limited to the U.S., Drew. We're getting concerning figures from all over the globe. Iran and Romania had daily death tolls that topped records. There are mask mandates in Eastern Europe. Turkey has reimposed curfews for seniors. Germany has the highest number of deaths since mid-April. There's a 3-day lockdown happening in Mongolia. What's going on around the world?
I think what we're seeing right now is that, this virus never went away. The methods that we have to control its spread are the same methods that we had some time ago. And if you, just think about people's behavior, it's colder. People are going back indoors. They're sick of practicing some of these public health measures that, did have a degree of effectiveness. And I think now we're probably seeing some of the consequences of that. The other thing that's happening is that, keep in mind, at the beginning of this outbreak, epidemiologists and virologists, you talk about seeding. Viruses need existing cases in order to spread to other people. And when this started, we were following a lot of cases, but it's not like this disease had really deeply penetrated everywhere. You had, a handful of cases here, a couple of really hot outbreaks in a few places. Right now, we're in a position where we have kind of the seeds of an outbreak spread widely all across the world. The base from which you're starting is much, much, much bigger than it was back in February or March or April. And that gives it many more opportunities to spread. And we're seeing the consequences of that bigger base that it has upon which to grow right now.
Drew, help us make sense of what's going on in the markets right now, because we're seeing these just devastating figures from around the world. We're also seeing new records in the stock market. Why are we seeing this disconnect between what's actually happening in terms of the virus surging around the world and investors' optimism about what the future looks like?
Yeah, sure. Well, I mean, listen, if I'm not going to tell you to rely on COVID modeling, I'm certainly not going to try to explain why the stock
Fair
market
point.
does on a day-to-day basis. But, in general, I will say that investors look toward the future. I mean, when you're investing in a company, technically you're buying into that company's future growth, with the possibility of a vaccine on the horizon. With that great data, the great top line data. Let me emphasize that we need to see a lot more details, but that great potential vaccine data. If a vaccine works and is rolled out, that is the beginning of the end of the pandemic. I mean, this is proven over and over again that there's nothing truly special or different about this virus. It's just that it's new, and very good at spreading from person to person. So, a successful vaccine means the end of this thing. It means going closer to back to normal. And if you're an investor in the future, that is about as good a news as you could possibly hope for. Combine that with lax monetary policy and all those things that we've seen, and that's certainly a reason for a booming stock market. You got to factor in all the political stuff and everything else that's happening around the world. But vaccine. If the virus has been the disease of the stock market for the last couple of months, a vaccine seems like the cure. So that's about as big a piece of good news as you can hope for.
All right. Well, I'm okay with ending on just a little bit of optimism and good news. Bloomberg's Drew Armstrong in New York. It's great to see you. Thanks as always for your time.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.